coming up.
Why you feel that Health Canada and perhaps the Minister has felt the need to vilify an industry that provides so much to so many.
We have a minister out there basically trying to ruin an entire industry for what reason, I don't know, a $13 billion industry, but continuously referring to that, and especially when then, if that really were the fact, of course, you would expect officials to have an answer as to where this factory was and how terrible it was.
U.S. states have actually realized that our regulatory system has become such an absolute failure because of this omnibus piece of legislation that U.S. states are actually incentivizing Canadian businesses to leave Canada and come to the States.
Labeling changes, which Mr. Harrington has already quite eloquently said are actually impossible to follow for the industry, and the significant cost recovery program, which, again, we all understand, I think, at least those of us over here understand, that that has the potential of driving 20% of businesses totally out of business in Canada. Is that true?
This Guy's Garage. Like and subscribe.
Committee will resume its study of Bill C-368, an act to amend the Food and Drugs Act, natural health products. I would like to welcome our panel of witnesses. We have representing the Canadian Federation of Independent Business, Jasmine Gannett, Vice President, National Affairs, and Michelle Auger, Senior Policy Analyst, National Affairs. Representing the Canadian Health Food Association, Aaron Skelton, President and CEO, appearing virtually, and Jules Gorham, Director with the Regulatory Affairs and Policy. On behalf of the Direct Sellers Association of Canada, Peter Maddox, President, and on behalf of the Food, Health and Consumer Products of Canada, Jerry Harrington, Senior Vice President, Consumer Health, and Robert Kremczynski, Vice President, Health Policy and Regulatory Affairs. Thank you all for being with us here today. Thank you. We're now going to begin with rounds of questions, starting with the Conservatives for 6 minutes. Mr. Doherty, please.
Thank you, Mr. Chair. To our guests, thank you for being here. I appreciate your testimony. I will start with Ms. Gorham. On Tuesday, Minister Holland, in his line of, or his opening intervention and his question, or his answers to the questions, as well as his officials, stated that over 4,500 consultations, a robust consultation process took place. I asked the officials repeatedly, twice, if your association, Canadian Health Food Association, was consulted. Both times they said yes. Is that true?
We were not consulted on Bill C-47.
C-47, okay. To the Canadian Federation of Independent Business, were you consulted on C-47?
If my memory is correct, we appear at the Senate committee on that bill.
Mr. Maddox, were you consulted on C-47?
No.
Mr. Kremczynski, or Mr. Harrington, were you consulted? Was your association consulted on C-47?
My recollection, it was involvement in the process when the bill was proposed, but I don't recall any Health Canada consultations. Mind you, that's a couple of years ago.
Is it your testimony today that that Canada already has a robust system in terms of stop sale for issues such as what the minister said? And I would have to say this. I would like to characterize his testimony as sensationalizing issues that can be found in many different areas. Repeatedly talked about rat feces and urine and foreign objects. As we sit today, is there policy in place, legislation in place, that can enforce a stop sale on a product if that is found? Ms. Gorham.
Yes, Health Canada and the Minister have stop sale powers on NHPs.
Okay. So I guess the question that I would ask then to all of our witnesses is if C-47 is so damaging, Vanessa's law is so damaging to our Canadian health food industry. Why do you feel that there was so little genuine consultation and that Health Canada then proceeded without allowing the industry with meaningful input? Why?
Me?
Yes, sure.
Sure, I'll take this. Thank you. Thank you, Chair, for the question. I should be going through the Chair. I don't know. I think we struggled. We spoke, Aaron and I and our team spoke about it after Tuesday. I think several times the department said that this is a very compliant industry, that they have very few problems, and there is a very compliant and very cooperative was said several times. So we failed to understand where there was no room to follow proper legislative processes, proper parliamentary processes, and why Vanessa's law had to be done through an omnibus budget bill, in the dark of the night and take everybody by surprise.
Well, and I might take it even a step further. We saw earlier this year when Health Canada officials characterized this as life and death. They used the death of the 18-month-old child in Alberta as a significant reason, as a catalyst to go moving forward with this, which I then called them on it. I knew I was very familiar with the issue and then called them on it repeatedly, that this was untrue, yet they refused to capitulate and reverse their decision and apologize for it. I think what we've seen, or I guess I'll leave that for question or for a comment from anyone on the committee as to why you feel that Health Canada and perhaps the minister has felt the need to vilify an industry that provides so much to so many. Mr. Harrington, would you?
I can't speak to the minister's thinking. I can say that this industry has an excellent reputation internationally. Since the introduction of the natural health product regulations, one of the first things we saw was over the course of the next decade, exports of those products from Canada more than doubled. That's a sign of confidence.
Anybody else? Go ahead, Ms. Auger.
Pardon me. So from our members' perspective, even when these clause and provisions were included in the bills, there was very little information and detail as to what that entailed. And so our members that are impacted by these changes were totally caught off guard because they didn't really know the repercussion. And that's the same thing that just occurred with Bill C-69. There are some impacts there with impacting natural health products. And so when we actually reached out to Health Canada and said, hey, what does this mean for small businesses? We've got nothing from them.
One last question, because I know my time is short. Just to be clear, this impacts Canadian businesses only. Canadians will still be able to receive online, over-the-counter, direct-to-consumer through Amazon and other, like foreign countries. Foreign products are not being met with the same regulations. Go ahead.
So in our consultation, we do highlight that, and it kind of creates an unfair playing field for businesses who are even trying to compete in Canada, operating in Canada. People are just going to go to Amazon and just import them and go under the radar.
And businesses go down.
Exactly. And that's all included in the consultation we've already submitted. Businesses are already feeling that with the competition of Amazon in other sectors.
Thank you, Ms. Auger.
Health Canada has submitted to this committee an extensive document that demonstrates meetings and conversations and consultations that have taken place on natural health products alone, going as far back as 2016. So let me ask some of our friends, maybe I'll start with Ms. Gorham, with you. Have you been meeting with Health Canada, or your organization, on issues dealing with natural health products over the last few years?
It is within Health Canada's mandate to consult with stakeholders.
So you've consulted over the last few years?
Regular consultations do happen. Consultation on Bill C-47 did not happen.
Okay. Mr. Harrington?
Consultations with Health Canada are a weekly occurrence with our organization.
So consultations do happen, and you've been meeting with them over the period of time. And in those consultations, there has been conversations around possible application of Vanessa's law. Ms. Gorham? Yeah.
If I just go back to Tuesday and quote the minister, he said, since 2014, there's been 4,500 consultations. That would equal almost 1.5 consultations a day? There has not been 1.5 consultations a day?
Sorry, I've got limited time.
Thank you very much, Chair. I'm going to direct my questions to Ms. Auger and Mr. Skelton. Ms. Auger, just if you could refresh the committee's memory. In the early stages of your statement, you talked about the confidence of small and medium-sized enterprises in Canada in this government is very low. Was that your term, or do I have it correct?
The level of optimism that we referred at the beginning of our presentation referred to the general state of the economy and how they perceive the future of their own enterprise. And so the level of optimism right now for small business owner is low because they are worried about the future of their small business. And there are many reasons for that. And one is the current economic conditions that they perceive to be difficult.
Very good. Thank you for that, sir. And of course, we on this side of the House would contend that those economic conditions are directly related to the policies of the NDP Liberal government. That being said, is it not true that inside this particular space that the majority of these small and medium-sized business owners are actually women as well?
We don't necessarily know the makeup from our membership. We could probably maybe do some digging and get back to you on that if that's something you'd like. But from our perspective, our membership is about split between male and female. I think we're probably closer to 60% on the male side, but for this specific industry, we don't know the accurate makeup.
Thanks very much. And through you, Chair, Mr. Harrington, do you have a comment on that? Many of these businesses in this sector are female-led businesses.
I think over my career, there has been a massive change in gender in industry in general. I would also highlight that women are the majority purchasers of natural health products.
Thanks very much. So, of course, any of these comments of the minister, and I hate to say them out loud again, but referring to this bill as a cuckoo bananas bill, and of course, as many of you heard, the minister continuously referring to this, even from the officials, this unknown factory full of urine and feces. And I guess I'll turn to Mr. Skelton. Do you find that these comments, these inflammatory and provocative comments from the minister, how do you think that's going to affect consumer confidence in the natural health product industry in general?
Thank you for the question. Yes. I mean, I think we're here disappointed that we're here in the first place. I think, moreover, we're bewildered that this conversation has to continue. This is an industry that has a very strong reputation and a very high trust amongst Canadians. We've recently surveyed over 81% of Canadians use these products. And to revert back to your question about ownership and who's running these businesses, the vast majority of these SMEs are female founded or led and operated. And so any comment that takes the 0.006% and paints a brush across a full industry, I don't believe would be helpful to that industry, no.
Thanks very much, Mr. Skelton, and to you, Ms. Gorham. Again, we asked officials to talk about this factory full of rat feces and urine, and of course they couldn't name it. I find that very disturbing, to be honest with you. We have a minister out there basically trying to ruin an entire industry for what reason, I don't know, a $13 billion industry. But continuously referring to that, and especially when then, if that really were the fact, of course, you would expect officials to have an answer as to where this factory was and how terrible it was. Do you have any insight for us as to where this this feces of rat full of factory is? It seems a bit odd to me. Now, listen, I know it's not humorous, but that being said, this is the minister's own words, which he kept referring to and over again. And for a Canadian, and I'm a very proud Canadian, to think that a minister would go on at length and numerous times to suggest that any industry in Canada was a factory full of rat poop and urine is absolutely ludicrous.
I'm going to start by saying that I think I speak on behalf of Aaron and myself and all of our members and probably all of industry and us around this table that we are pretty shocked to see that on one hand, we're being said and you are being told that this is a very, very compliant, very cooperative industry. But then on the other hand, the worst case scenario in the past 20 years of this regulatory system is used to shame and stain a Canadian industry, one that we are all very proud of. We've all worked very hard to get it to where it was. So I'll start by saying that. As for the situation that we believe he was referring to, I don't know. They didn't say the name. The situation that we believe that he was referring to, I think we do know because, like I said, it was the worst case. I will say, though, that, however, that happened since 2023, since this Vanessa's Law was passed, since the definition was changed. However, that situation was resolved using the powers that they had already had previously. The site license was suspended for 30 days. The company was given a chance to course correct. They submitted their course correction to Health Canada. Health Canada didn't accept it, and their license was cancelled, and that worked. So I just find it a bit surprising that what is used to justify the need for this omnibus bill's powers were not even used in the situation that was used.
Thank you, Ms. Gorham. Dr. Pawlowski, please.
I'm always asked to follow up on the rat poop questions from the Conservatives here. Puts me in an awkward position, I have to say. So this law, the proposed law, would remove the protection of Vanessa's laws, their applicability to natural health products. The Deputy Minister of Regulatory Operations and Enforcement appeared before us earlier in the week. We asked her specifically, doesn't the government already have the power with stop sale to be able to prevent the sale of a product which was dangerous to people on the market? And she said no, that does not give them the power when a product is actually on the shelf to prevent it being sold. And this would be one of the changes that would occur if this law was passed. It would prevent the recall of natural health products that present a serious or imminent risk of injury to human health. I think from the Canadian Health Food Association has already responded to the question about recall, although I'm not totally clear where you were. I think it was, yes, we approve, but we don't like the way it was done. I think Mr. Maddox basically the same thing. I wanted to ask the Canadian Federation of Independent Businesses. Now, you represent, 5,000, 7,000 businesses? I mean, a lot of people in Canada work in businesses. You represent natural health product businesses, but you represent a lot of other people. Are you really telling us that you don't think the government should have the ability to recall a product which presents a serious or imminent risk of injury, that the government should not have the power to take that off the shelf?
Not saying that. In fact, we represent 97,000 small and medium-sized businesses from across the country, and about 2,000 of those are involved with natural health products. What our members feel is unfair is the way that these policies are being put in place. They're being tacked on piece by piece. There's no long-term vision, and they're not getting a lot of information or detail from Health Canada as to why these pieces are being implemented and how they're going to impact their business. That's where our members are upset. They're not. I don't think they would oppose a stop law, but what they are opposing is the way that these policies have been tackled on, and they want to be part of the conversation. They want to be sitting at the table, talking to Health Canada, asking them questions about how these new policies continue to impact their business. And I did mention Bill C-69, which had natural health product implications, and we're still waiting for responses from Health Canada as to how those will impact some of our members.
I can appreciate the fact that you were unhappy with the process, the kind of consultations and things, but the question remains, do you really not think the government should have the power to pull a product off the shelf when it presents a serious risk to people?
From our members' perspective, it's not that they're opposed to regulation within that industry. It's being part of the conversation. I'm here representing the voice of small businesses, and that's what they're telling us. They don't want to be included in part of the pharmaceutical process. They believe that NHP needs to be regulated separately.
Thank you, Mr. Chair. And I want to thank all of our witnesses for the opportunity to share your side of it. I, like many of my colleagues, was absolutely blown away that the Minister of Health would come here and decide to describe in such horrendous detail and talking about rat feces, while trying to say this is an industry I totally support and it's very compliant, but like rat feces, urine, foreign bodies, and then when we tried to drill down with officials later on, how many cases we were talking about, we didn't get an answer. I asked for that information to be available to us. Unfortunately, we don't have it by today's meeting. I'm not sure if we'll even get it, unfortunately. And we hear in earlier testimony that you guys are pretty confident because of the amount of detail that you know exactly which person, and that the rules that are brought forward by this bill weren't even used in the dealing with that case. My question to you is, did the minister's testimony impact businesses that you have talked to, Ms. Auger?
Yeah, I mean, we weren't here for that testimony, and I can't speak on behalf of our members directly and how they felt about it, but we know, based on the small business we represent, they just want to be compliant as much as possible, but they also want to be able to compete in Canada and reach consumers, right? And so by tacking on all this additional cost and regulations, it's really hard. It's hard for small businesses, and they're really concerned about all of these new rules.
Thank you. So, Ms. Gorman, so you were earlier saying that U.S. states have actually realized that our regulatory system has become such an absolute failure because of this omnibus piece of legislation that U.S. states are actually incentivizing Canadian businesses to leave Canada and come to the States. What kind of an economic impact will this have on Canada?
I think there's been some attempts to just separate out Vanessa's law and say that there's no cost to Vanessa's law. What we are saying is that there are 6 major changes rooted in this redefinition of NHPs as therapeutic products. When you look at 6 major changes, 2 legislative and the others regulatory, it makes it very, very hard for a small company to stay competitive, to compete with the big guys. We have 2 really big guys in Canada, a few medium and the rest are small, and there's a lot of micro, and we can look at Indigenous businesses in the space as well, which are, I think, smaller than what would define a micro NHP company. It becomes very, very hard to stay afloat. It becomes very hard to even stay competitive. When you walk into a natural health food store and you go to buy, I'll use a vitamin C because it's well known, there's a reason there's not just one. There are many, many options in vitamin C. There is no patent IP protection on NHPs. So you can put a product out, you spend on innovation, you spend on research, you put a product out, someone can copy that product tomorrow and it'll be on the shelf right beside yours. So to stay competitive, prices have to stay within a range that people will afford, and you can't price yourself out of the market. What's happening in the States is that they're not facing this regulatory burden. It's a lot cheaper to operate, and even with an exchange rate, you can sell your products into Canada online on the 90-day importation at a much lower cost. So the Canadian consumer is not knowing, is going for the product that they can afford, that's available to them, it ships to their door. But in the meantime, we're losing jobs, we're losing production, we're losing retail here in Canada.
Thank you. It's incredibly troubling. You brought up the Indigenous piece, and so will this actually impact traditional Indigenous medicines?
I would like to say yes, because I believe that there's a reason that those things need to be studied before any change in legislation or regulation is made. There's a reason that those studies need to be. What those impacts are, I can't tell you because it's not up to me to do the study, and we don't have those study results in our hand. But I would assume that for communities that have been foraging and making their teas, those are, under these regulations, considered natural health products. And so the rules that apply also apply to those communities and those medicine peoples as well.
No, thank you. I appreciate that. And I know we heard through testimony that 84% of women utilize natural health products. You highlighted the fact that your lipstick can't be recalled, but your lipstick is something that I think is a unique space, and there's all kinds of conversations around cosmetic products that I know have happened through decades of conversation around regulation. it really troubles me when we asked if there was a gender-based analysis. Again, I asked the minister's officials whether they would table them. We still don't have them. Hopefully we will before we have to make these decisions. But we are left to trust that there was actually a gender-based analysis done on this. Ms. Gorman, do you have any statistics by chance of how many of these small and micro businesses are women entrepreneurials?
Ms. Gorman, a brief response, please. Ms. Goodrich talked right through her time.
Actual statistics, no, but when we look at our membership, we think that we believe that in the micro and small space, especially in the startup space, women's health, we are looking at probably 45 to 50% of those being female.
Do you think that the government should be able to mandate a recall? And if you do, can you just lay out the importance of that?
There are two aspects. One of them, again, I mentioned before, is reputational. The other aspect, and I think it was a good point raised earlier in this discussion, is competitive situation of manufacturers. You not only face the possibility of those people, harming the reputation of the industry, but you also are having to compete with people who aren't following the same rules. And so from an industry growth perspective, there are additional protections there.
Thank you, Mr. Harrington. Thank you, Ms. Kayabaga. Mr. Doherty, please, for 5 minutes.
Actually, I will take us around.
Dr. Ellis, please.
Thank you very much, Chair. It's interesting, Ms. Gorham, you mentioned 6 major changes to regulations in the industries, which realistically is related to the change in definition around a therapeutic product and how natural health products fit in there. And that is directly addressed by Bill 368. We focused very much on Vanessa's Law and those kinds of things, but all of the other changes, because of the change in definition, would follow suit, which are the 6 major changes that you have outlined. Could you please tell, for the benefit of those listening at home, what those 6 major changes are?
Yes, so as Mr. Harrington has referred to, the labeling changes were put through as law in 2022. Those are to start being enforced early next year. Those labeling are to essentially make NHPs a lot more similar to over-the-counter medication packaging, essentially drug packaging. We have a cost recovery proposal that is now in its second consultation, has closed down, so this must be one of the consultations that is being counted. That was on cost recovery. That one is set to, regardless of anything, that is set to go into Gazette 2 spring 2025. The industry will be faced with cost recovery fees as of December 1st, 2025. We have these 2 omnibus bills in C47 and C69, and we also have new good manufacturing practice guidance and quality guidance that is coming out. The one that was written before was written in conjunction, the department and industry. The new one seems to be very, very similar to what is out for pharmaceuticals.
Thanks very much. And so really this characterization that 368 will only change Vanessa's law is actually not true.
I think when we want to narrow it down to it's only about recall powers, it's a simplifying. What we did is we redefined natural health products as therapeutic drugs within the Act. The Act is the highest level, and everything flows from that.
So then realistically, what we understand is to be followed is labeling changes, which Mr. Harrington has already quite eloquently said are actually impossible to follow for the industry, and the significant cost recovery program, which, again, we all understand, I think, at least those of us over here understand, that has the potential of driving 20% of businesses totally out of business in Canada. Is that true?
That's exactly true. Yes, no one is going to leave Canada simply because of recall powers. It's the sum of the total of everything that's happening.
Very good. And of course, we know very clearly, as has been elucidated here, that over 80% of Canadians use natural health products. And the result of many companies going out of business or driving their business elsewhere means, in simple terms, people will access these products in other places online most likely. Is that true?
We did a recent Leger report that we're happy to table to the committee if you would like to see it, but we just did a recent Leger report just to get an understanding of that. And what we see is that Canadian consumers really do value Canadian-made products. I think all Canadians try to buy local as much as possible. There's a great reputation. The industry is safe and compliant. These are low-risk products. However, the driving, I'll say, decision maker is accessibility and price. The way we are going, our prices will be more expensive when competing with the online world over the border.
I think the other thing that's incredibly important, besides all the things that you have talked about, including consumer choice, et cetera, is related to how these products are treated by the government. A part of it we heard on Tuesday was related to a study commissioned, I think it was by CHFA, with a very reputable company, Deloitte. And of course, the minister, using his usual bombast and provocative nature, even called that study into question of a company that actually this NDP Liberal government uses for consultations themselves. Once again, mischaracterizing the industry as a whole. How does that, again, as a representative of that industry, make you feel?
Very saddened, if I'm to be very honest with you, very disappointed. I think this industry has gone above and beyond to offer Canadians safe, reliable products. I think what maybe a lot of people don't understand is that the regulations that are already in place are what guarantee safety, efficacy, and quality. That is the pre-market approval system that Canada has. So to hear that being torn apart, and to hear that this, to have this industry shamed and stained, I think we were sad because we've all spent our careers in this industry and we're very proud of it.
Thank you. You should be. Thank you.
Thank you.
Thank you, Ms. Gorham.
I really think that it is frustrating to me that this government is now saying that this is like basically and I quote the minister, a cuckoo's banana bill to go back to a regime that was the regime that this government did not spend any time actually quickly fixing. They only decided to put this into an omnibus bill and hide it after being in power for 8 years. So after 8 years, they didn't do this as a standalone bill. After 8 years, they decided to put this hidden into a very large bill, hoping that Canadians wouldn't see this. And yet now they're trying to say that this is the most important piece to protect consumers, and then try and scare consumers on the entire industry by talking about an absolute one-off case. Ms. Gorham, I'll start with you and we'll move down. Do you believe that this common sense bill from my colleague Blaine Calkins is a better solution than what it currently exists in our legislation?
I think that this bill is important because it's given us the opportunity to come talk about it, which we were not granted before Bill C-47. So for that, I'll say thank you, Chair and all members. It's the first time we kind of all have our say. But I think the bill is also important because putting natural health products under the definition of therapeutic drugs is not what's good for industry. It's not what's good for Canadians. If there are gaps, those can be addressed and discussed.
Mr. Maddox?
I think if I could add...
Sorry. Mr. Maddox?
I don't think this bill is a solution, but it's certainly a good step back and let's reset. And you can see here we've got 4 associations. There's many other associations like Traditional Chinese Medicine and others. An incredibly passionate industry. You've probably all received postcards from people in this industry. We want to consult. We want to be involved. We probably the most open, like in my time working with these people, we're probably the most open industry in terms of sharing solutions and working towards best practice. So let's take that step back and then we can work out what's next.
Thank you. Ms. Auger or Mr. Gannett?
Yeah, I think from our members' perspective, this bill is so important. It's not a solution either because what existed before is not perfect either. It certainly has some issues to it, and those have been raised by our members before. But, taking a step back and really assessing the bigger picture and taking a look at cost recovery and the impacts that will have on small businesses is certainly an important step too. I will add that we do represent traditional Chinese medicine as a group of ours, and they have provided us with some significant numbers in terms of how all of these changes are going to impact their imports of products, and something as simple as a ginseng bottle may cost a consumer a significant amount of money going forward in Canada.
Thank you. Mr. Harrington?
I'll concede the question, Ms. Kremchinsky.
Thank you. I think, when we're thinking about this bill, I think from FHCP's perspective, we appreciate the attention that it's bringing to talking about the challenges in the NHP program, things like labeling, things like cost recovery. These are all things my colleagues across the table have talked about today. But all of these, actually, they predate Vanessa's law. And I think Bill 368, it doesn't solve those problems. But we do really appreciate the opportunity to talk about what are these challenges facing our industry and thinking through how can we work to solve those. I think, as we said in our opening statement, this bill doesn't solve those problems, but by working together, we can find those solutions and bring that forward to be safe and provide a common sense approach for Canadians.
Thank you. And I will go to Mr. Skelton.
Yeah, I think this is a point of clarity. Vanessa's law is not recall powers. Vanessa's law is the recategorization of NHPs to be the same as pharmaceuticals, and that's the concern. I think if there's proper process and discussions and deliberations and analysis, we're all open to that. I think everyone across this group would be open to that. But it's the reclassification that imparts the recall powers that's the concern.
I think this is part of a larger space that we've been hearing, and I know myself and many of my colleagues, I would assume most members of Parliament, received thousands of pieces of correspondence and individual unique ones. I know I talked to many people that brought this forward as a very serious concern because they wanted to have their choice in an industry that they trust and be able to make an informed decision, and that has been robbed of them, or they feel like that is going to be. Mr. Maddox, I'm going to give you the last word because you've raised so many concerns regarding the imports and the stuff that is just coming across the border. And I'm just wondering if you can clarify if there's anything else you'd like to say on this, because I think this is something that we really need an economic impact. And I don't know if the government actually did that, because I don't think they actually understood that this was a problem.
No, and I was interested in the question about whether industry had done research on that, and maybe interested can play a part in government doing research on that rather than it being on industry. We definitely want to play a role in that. But to me, the fact that I can go online and order an unregulated product from Mexico or Japan or the US or wherever, and it may have ingredients on it, but I don't know if what it says on there is what is in it. Whereas when I order a product from Canada, I know, or a product that's regulated in Canada. So yeah, I think that's a really important step in terms of how do we have more oversight of that, and I guess how do we understand the size of that issue.
Thank you. Thank you, Mr. Maddox. Thank you, Ms. Goodrich. Last word goes to Mr. Nakvi for 5 minutes.
Thank you very much. And again, first of all, thank you to all of you for being here, spending that much time with us, and your thoughtful remarks. Mr. Harrington, I wanna talk to you a little bit about your views on Vanessa's law. What I'm hearing from you, that it's an important piece of legislation that is good for consumers in protecting Canadians, but also for industry. Am I correct?
We see no harm in it, absolutely.
And again, just to clearly understand your view about this particular bill that we are discussing, that you feel that this bill, if passed in its current form, could be harmful to the industry and to Canadians.
Doesn't solve the problems that we're facing. Maybe put it that way. And I want to keep coming back to that.
Because I think I'm hearing from you that operations, how Health Canada is sort of the operating side of things is more of a bigger concern for you.
Yeah, making natural health products therapeutic products does not necessarily make them pharmaceuticals. In fact, the therapeutic product regime goes from pharmaceuticals and vaccines to medical devices. It is a broad category. The real issues that we're facing are regulatory. It has been identified from the time Vanessa's law became law that we need to treat consumer health products differently from prescription drugs. And if the fact that we're spending this much time talking about labeling is one of the most obvious reasons for that, because you label a consumer product in a way that consumers can use that product without any professional supervision. So those kinds of issues that have developed over time, the cost recovery problem, the post-approval inspection issue that is very real, those are all things that emerged prior to the application of Vanessa's law, and they'll still be here if Bill C-368 passes.
So the set of issues that you're raising, this particular bill does not solve those issues. And we need to have a more thoughtful, serious conversation on other issues as opposed to somehow give the impression that this bill deals with the issues around labeling or cost recovery, etc. Correct?
Absolutely.
So this is a very focused bill that deals with recall, and again, just to reaffirm, to hear what I'm hearing clearly, that this could hurt industry and Canadians if it's passed in law.
Put it this way. We didn't need Vanessa's law in order to have confidence in these products. But having now applied it, pulling it off is not a good look. It's not a good look for our industry. It's not a good look for our reputation as a sector. And it takes us out of the modernization process that's been going on for some time in the Food and Drugs Act with new tools that are actually going to be very useful in solving the problems we've got.
Look forward to working with you on other important issues that you've raised. Thank you, Chair.
Thank you, Mr. Nakvi, and thank you to all of our witnesses for being with us today, and thanks for hanging in there for the late start. We appreciate you being with us, and we appreciate the service that you provide to your members and the level of preparation that you've very clearly put into your testimony here today.